Good morning, friends. Come on in and get settled, and we will get started here in just about a minute. We'll just give people a chance to get in and get settled before we get going. Okay, bringing up the slides. And we will be ready to have you ask questions anytime. So just a few more seconds and we'll get started. So if you have questions, please drop them in the Q&A box. You should see a menu on your left, and I believe it says chat. My side, it says chat. So you'll see chat and Q&A. So drop those in the Q&A, although I'll see both of them, no matter where you write it. So good morning. I'm so happy that you're here with me. My name is Dr. Sonia McGowan, and I'm the owner of Covenant Pediatric Wellness Center in Jefferson City, Missouri. We specialize in kids with complex needs, and it's what I've done my whole life. And so we're really happy to just share more resources with you on this platform. So I am lucky. So I have the very best husband in the world. That's him. You see Shannon. He's a CPA. We have two kiddos. We have Libby and Rowan. Libby will soon be 21. Rowan just turned 19. She is a musician and is a music director for the School of Rock in Kansas City. And that's her, you see, with the bass guitar in her hand. And that's her mama behind her. We were able to play at an open mic night together a few years ago. As you can tell, they're both, grown big people. But when they were little, Rowan, my son, had lots of issues. So you'll see that picture of him holding his ears. This was life for us. He had lots of sensory issues, couldn't stand to have his hair cut or his nails trimmed, couldn't stand to sleep on anything except one particular pair of flannel sheets, lots of behaviors, lots of sleep issues, lots of skin issues. And so he really is the reason that my practice looks the way it does today, and the reason that we work so hard to recover complex kids. And then the other little creature you see there, that's Ozzy. He's our new sheepadoodle puppy. We got him right before Christmas. He's about 4 or 5 months old now. He's actually at a training program, so he's learning to be a very well-behaved boy. So you can see over in the corner, I was trying diligently to work, and he finds a way to get mom's attention. So, all right. So let's talk about what we do here. So primarily we work with kids with complex needs. That can mean a kid with autism. It can mean ADHD, all the way to a kid who does not have a diagnosis. They're just struggling. So any kind of issues around behavior, coping skills, sensory issues, behavior, language, communication problems, right? That's really what we focus on. We also do a lot of work around oral restrictions. So babies, toddlers, kids, adults who have tongue, lip, or cheek ties. So we do the evaluation. We do the therapies to get that person, adult, child, ready for the release. We make that referral, and then we continue therapies afterward. We also have a moms and babies program. And so all of our doctors here are Webster certified. So we really understand the needs of pregnant women. And then that just sort of dovetails right in with newborns. So we do a lot of care for newborns as well. We do chiropractic for all ages. We do ion cleanse detox. We do nutrition testing. We do lots of labs. We do hyperbaric oxygen therapy. And then we also have Covenant Pediatrics. So we have a general pediatrician on staff. Her name is Dr. Hannah Strong. She currently is taking new patients. And she is really the only doctor in our area who does not require kids to have certain things that other doctors require them to have. You know what I mean? So holistic, easy to get into, very responsive, long appointments. We don't overbook. So yeah, if you are in need of a pediatrician, we've got you. So our motto at Covenant is the why matters. We want to get to the bottom of whatever is causing the behavior, language, communication challenge, the sleep problems, the eczema, the constipation, right? We don't want to put a Band-Aid on it. We want to figure out the why, fix that, and then off we go, right? And so we really believe strongly that, we have to understand the why. There are no purposeless behaviors and there are no bad kids. And when we can figure out exactly what's causing the challenge and fix it, then all the better. So let's talk about nutrient deficiencies in behavior. So quick biochem lesson first, okay? I promise it'll be quick. But what you have to understand is that we don't just eat for pleasure, right? We eat because we need fats, carbs, and proteins to then fuel our bodies. And so when we look at this, again, our food is comprised of lipids or fats, carbohydrates, proteins. And each of these types of nutrients has a pathway of digestion. So it has to start with eating the right things, right? And then we have to be able to digest that robustly so it can move on down that biochemical pathway or chain. And so what we very frequently see is as we move the fats, carbs, and proteins on down the line, our goal is to make energy with those nutrients. We do that through something called the Krebs cycle. Sometimes it's called the TCA cycle. But basically, look at it like a wheel that creates energy, kind of like a windmill, right? And so you've got to have all the right pieces in place so the Krebs cycle is efficient so that it kicks out cellular energy. That energy is called ATP. It's the energy currency of the body. And what I'll tell you after, all of my thousands of patients and years of experience is our kids are not great eaters, right? So generally they're pretty selective. They want certain things like chicken nuggets and mac and cheese and pancakes and things like that. They're not tearing it up on broccoli and spinach and kale, right? And so they're selective eaters. They're not great at digesting. Most kids have low levels of digestive enzymes. They tend to have low levels of hydrochloric acid in their stomach. They're just not great at breaking their food down. The food that they do break down, once it gets to the Krebs cycle, generally we find that the Krebs cycle is very dysregulated. It's very inefficient. So they're not great at making energy from their food. Why do we care so much about making energy? It's a very foundational chemical process, and you have to be good at that in order to be good at higher level things. So if you're not making energy inside the Krebs cycle, you can't expect to have good digestion. You can't expect to have a good functioning immune system. You can't expect a child to sit down and focus and pay attention in school if they don't have enough gas to make the car go. And this, as a general rule, is a problem for most kids with complex needs. And again, if you have questions at any point in time, drop those in the Q&A box for me and I'll answer them as I'm able to. So remember, we talked about fats, carbs, and proteins. So each one of these has specific purposes. So fats, for example, are a very important source of energy. You get more energy per calorie from fats than you do anything else. And so most kids are not eating enough fat. Most kids aren't great at digesting fat. And so they miss out on a great deal of energy because they're just not digesting very well. Now, when we look at carbs, well, let's look at some more about fats. Fats are important for the structure of your cells, right? So they're important to keep. When you look at individual cells, what you want is for that cell wall to have enough structure so that good things come in through the cell wall and bad things, used up things, toxins can move out. And if you don't have enough fat in your diet, those cell walls aren't going to be sort of that rigid permeability that we need. Fats are super important for hormone production, and they're very important to help us absorb fat-soluble vitamins. Carbs are fast energy, right? So that's why when, it gets to be 2 or 3 o'clock and you start to, wane a little bit in the afternoon, why you tend to reach for a candy bar or M&Ms or a soda, right? Because those things that are high in carbs give us quick energy to the brain, but the energy doesn't last very long. Carbs, especially things like fruits and vegetables, provide fiber, which makes the belly happy, and they promote glycogen storage. So it helps store glucose in the muscles. And then protein is important for muscle structure, muscle function. Proteins help us make enzymes and hormones and help promote a good immune system. So all of these types of nutrients are critically important. And so we've gone from fats, carbs, and proteins, right? Now we're going to talk about individual B vitamins. So I'll tell you, I do a lot of nutrition testing with kids, and it is rare for me to see a child who does not have pretty significant nutrient deficiencies, despite mom and dad doing their very best to feed them good food, okay? So vitamins A, C, and E are considered antioxidants. Vitamin A and vitamin E, also D and K, are fat-soluble vitamins. So all other vitamins are water-soluble, meaning if whatever you don't need, you're going to flush away in your urine. Not so with A, D, E, and K. So those we have to be a little bit more careful with on our dosage because we don't want to overload the liver on those. So vitamin A, just like you've heard, stereotypically, it's great for vision health. It's needed for skin, immune function, cell differentiation, and then you can see a couple of food sources here. And food sources, they're important to know, but so many kids really struggle, not only with selectivity, I don't want to eat liver, right? What kid is going to eat liver? But things like milk and cheese and egg yolks, those are highly allergenic for some kids. So a lot of kids have allergies or sensitivities that keep them from having certain sources of these nutrients. And that just adds another layer of challenge there. So vitamin C, again, is an antioxidant. It is really critical for immune system function, for wound healing, for collagen synthesis. And most people are really surprised to hear that things like bell pepper, broccoli, and tomatoes have high levels of vitamin C. We tend to think, citrus fruits and berries mostly having vitamin C. But bell peppers, broccoli, those are really good sources as well, if you can sneak that in for your child. Vitamin A, another antioxidant, important for, sorry, did I say A? I meant E, vitamin E. It also is an antioxidant, a very important nutrient for immune function, skin health. And so vitamin E is going to be in green leafy things, avocados, nuts, and seeds. Vitamin D, another fat-soluble vitamin, important for us to be able to absorb the calcium that we eat, important for immune system function, bone health. Vitamin D is highly anti-inflammatory, and it's really great for mood stabilization. Most kids with complex needs are low in vitamin D. I would say of the kids I test, 95 or more % are low. And, part of the issue too is reference ranges. So for example, vitamin D, they say 30 to 100 is normal. Well, right, who's not going to be normal with a wide range like that? I shoot for about 75. I think that's, in general, that's the neighborhood of a good therapeutic level, especially going into parts of the year when we don't have as much sunlight. So I look at functional levels more than just the specific reference ranges given by the lab. Glutathione. Has anybody heard of glutathione? If you have, shoot me a comment here. Glutathione is our master antioxidant. So it's very important for detoxification. It's important for liver health, immune function. It helps us make DNA. And so again, it's another nutrient that most kids are who have complex needs are low in. And then finally, when it comes to antioxidants, we're talking about CoQ10. It's very important for energy production. So it's involved in the Krebs cycle that we talked about a couple slides ago. And so again, look at the food sources, fatty fish and organ meats. I know I'm not eating any of those. Other people might. I think my mom scarred me with liver and onions when I was a kid, right? So I'm out on that. So my point is though, we don't have a lot of kids with complex needs who are willing to eat things like mushrooms and cod liver oil and fatty fish and other organ meats, right? So getting these nutrients into kids can be a real challenge for parents. All right, so let's talk about some B vitamins. So we have a long list of B vitamins. Again, this is another area where I find kids are very, very deficient. The other thing you need to understand about B vitamins is, they each have a job. Most kids are deficient, but this is why it's important to work with a practitioner who has some experience, because while a child may come up on their testing as desperately low on most B vitamins, there are some kids that when we give B vitamins too much, too fast, it can cause some side effects. So kids can maybe have sleep disruption or become irritable or growly. And so you just want to make sure whoever you work with has some experience in managing a situation like that. So let's look at vitamin B1. Converts carbs to energy, supports nerve function, aids in digestion. So remember, we've got fats, carbs, and proteins, right? We have to distill all that down so that the Krebs cycle can start. Most kids are deficient. So when in B vitamins. And so what you're going to see, look here, B2, B3, they all say converts food to energy. So if you're already low in B vitamins, that child is behind the 8 ball when it comes to making ATP, right? So it all dances together. You have to have all parts of that sort of biochemical scenario in order to have good mitochondrial function making ATP. Vitamin B2, again, converts food to energy. It's an important antioxidant, important for detoxification, and it activates other nutrients. So if you don't have enough B2, you're going to struggle with making ATP. You're going to struggle with detoxification. And even let's say you have plenty of other nutrients. If you're low in B2, B2 activates many things. And so without B2, the other nutrients aren't going to be able to do their job as effectively. Vitamin B3, again, the converting food to energy. It helps us synthesize cholesterol. So we get cholesterol in a couple of ways. Our liver makes it, and we get it from food. And most kids with complex needs have low cholesterol. Most of the time, our society is really worried about cholesterol that's too high. But in kids with complex needs, we check to make sure it's not too low. And it is so common that in almost every kid I see, I test their total cholesterol. Cholesterol is important for hormone production. It's important for brain health, whole long list. If you want more information about the effects of low cholesterol, go to my website, thewhymatters.net, and there's a whole webinar about that from a couple months ago. But if you don't have enough vitamin B3, again, you're going to struggle with appropriate cholesterol levels. B3 is also important for repairing DNA, for signaling inside, outside the cells. So very, very important. And you'll also see the alternate names at the bottom. So B1 is also known as thiamine. B2 is also known as riboflavin. B3 is niacin. Okay. Now, B5, also known as pantothenic acid, again with the energy metabolism, again with the synthesis of cholesterol, and then hormones as well. Vitamin B6. Some of you may have been in the game long enough that you remember, gosh, I'm going to date myself, but back in the 90s, it was discovered that when you gave kids big doses of vitamin B6, kids with autism, their behavior and their sleep improved. And so that was sort of really the beginning of the whole biomedical autism recovery movement. It really started with B6. Okay, I need you to give me one moment. I've got to send something. I'm so sorry. 0281714. Okay, sorry about that. All right, so vitamin B6 was a big deal in sort of starting the whole movement that, hey, maybe there's something we can do to help recover kids with autism. So B6 is important for amino acid metabolism, neurotransmitter synthesis. So think things like dopamine, serotonin, those mood regulating neurotransmitters, and then immune system function as well. Vitamin B7, also known as biotin, is important for the metabolism of fats, carbs, and proteins, right? We've got to be able to have B7 to break those things down. Also important for healthy hair, nails, skin, and for gene regulation. And then finally, B9 is also known as folate. It's very important for things like methylation, DNA synthesis and repair, formation of red blood cells, and amino acid metabolism. I haven't had enough caffeine this morning. And then finally, our last B vitamin is vitamin B12, also called cobalamin, energy production. And you hear all the time, people say, oh, I got a B12 injection, or I got, IV fluids with some B12 in it, because it gives you energy. Also helps with your red blood cell formation, neurological function, DNA synthesis. So you can see when you look at each of these individual B vitamins, they're all important. They all have a job. And if the child is deficient in these, their downstream biochemistry just can't work efficiently. So we talked about antioxidants. We talked about B vitamins. Now, with minerals, there's a long, long list of minerals. There are many of them. We think about things like calcium and magnesium, potassium, sodium, zinc, etc. So in general, rather than go through each one, I'm just going to give you a general overview. So minerals in general are calming to the system. They're essential cofactors that make the B vitamins work more efficiently. They're important for fluid balance, for immune system function, neurotransmitter function. So they do a lot of things. Many, many kids, I would say if I had to pick the most common deficiencies for kids with complex needs as it relates to minerals, definitely magnesium. Almost every kid is deficient in magnesium. I'm seeing more and more kids who are iron deficient, lots of zinc deficiencies, lots of iodine deficiencies as well. Okay, so how do we know if a biochemistry problem is causing issues? So I tend to look at a couple of things. I look at physical signs, I look at behavioral signs. And so if we look at physical clues, I will generally, if I see skin issues of any kind, this is a functional nutrition situation. So because skin is a reflection of intestinal health, we often see kids who have not great intestinal function. So we'll see things like eczema, especially on the face. We'll see eczema on the behind the knees or the bends of the elbows, on the face. Sometimes kids are covered from head to toe with eczema. Eczema is bad, okay? It's not just eczema. It's not, oh, just put a hydrocortisone cream on it, it'll get better. It's a reflection of the intestine, and it tells us if their gut health is inappropriate, and that we need to pay more attention there. It's really common for me to see what's called KP or keratosis pilaris. Some people call it chicken skin. So it's that generally the upper arms, sometimes the thighs, sometimes the whole body. I've seen kids who've had it from their chin to their ankles, but it's kind of that bumpy, rough skin. It's really common to see dry skin, to see stinky feet, kind of unusual body odor for their age, kids who are really pale, who have dark circles under their eyes. All of these are signs to me that they need intervention. Herpetiform rash is usually on the flexor, so usually behind the knees or at the bends of the elbows. My son had this. This could be his picture, honestly. When he was a toddler, the backs of his knees were constantly just horrible, to the point where they would bleed sometimes. And generally, it's a symptom of a gluten intolerance. It definitely was for my son. Once we took gluten out, all of this herpetiform rash went away. I also look at hair. So kids who have hair that is flyaway, that won't lay down, if it's thin or sparse, if it's not growing as we would expect. Fingernails and toenails also that don't grow as we expect are telling me generally that there's something going on in the chemistry. Lips. So I look carefully around and inside the mouth when I examine a child, and it's very common to see lips that are very dry. Sometimes they're cracked and bleeding. Also really common to see cracks at the corners of the mouth. That's called cheilitis. And generally, both are signs of deficiencies. I also look at the tongue. It's really common to see a geographic tongue like this, so it kind of looks like a map. And also really common to see a fissure down the middle of the tongue or cracks along the surface of the tongue. Also really common to see scalloping here at the edges of the tongue as well. I look at fingernails, so I'm looking for things like white spots, which almost always point to a mineral deficiency. Most of the time it's zinc, though not always. We'll see lots of ridging of the fingernails. We'll see spooning of the nails as well. And all of these things are definite signs that we need to look deeper into their chemistry. I look at head shape as well. So a prominent forehead is often if it doesn't run in the family, is often a sign of a vitamin D deficiency. A head that's large in relation to the body, or head shape differences. So kids who have plagiocephaly or a flat spot on one side of their head, all of these are clues to me that we need to look a little bit deeper. I look at bellies a lot, and I palpate bellies a lot because we've got so many kids who have a lot of belly pain, who have a bloated abdomen, who have abnormal bowel sounds. And so it's really common to see a presentation like this where, child is normal weight, but they have a huge belly. So that definitely warrants further investigation. So let's talk about behavior. When parents are talking to me about, oh, my child does this or they do that, I'm immediately, rolling differentials around in my mind, because there are some associations we've made over the years with, this behavior often means we need to look deeper for this particular situation. So when we see food issues, these are really common. We see kids who are very selective eaters. We see kids who don't want to sit down and eat a full meal. They just want it to graze. They want to have a few bites throughout the day. This is a really, really reliable sign of abdominal pain. So even if the child doesn't have, the verbal skills or the vocabulary to say, hey, yo, my belly hurts, when they graze that way, it's a pretty reliable sign. Self-induced limited diets. Sometimes this is an issue around their chemistry. Sometimes it's an issue around oral restrictions. So it really kind of depends on the presentation. But we also look at cravings too. So often when kids have deficiencies, it can make food taste different to them. So they're what they're willing to eat gets smaller and smaller. And sometimes cravings point us to allergies or sensitivities. So I've worked with kids in the past who, parents will say, this child, if I let them, would drink a gallon of milk a day, or they'd eat a loaf of bread per day. And in extreme cases like that, I'm immediately thinking, this is important. We generally crave what we're most sensitive to. So while it isn't good for us, we will crave it. And so I definitely see this a lot with things like dairy and gluten and sugar. Digestive challenges are really, really common. So kids who have constipation, kids who have diarrhea, belly pain, sometimes kids will have both constipation and diarrhea. They'll alternate. And really what's happening is they're constipated, but diarrhea breaks out around it. We call that breakthrough diarrhea. These are two separate kids, both my patients. They don't know each other. They live in completely different parts of the United States. But look, it's the very same posture. So we see kids who will posture in a way that puts pressure against their abdomen because their belly hurts. And kids who have a lot of gas, bloating, gas pain, poop troubles, really, really common. We see all sorts of problems here. And I wish this picture had better exposure, because this is a child who withholds her poo. It's very painful for her to poop, and so she tries not to do it. And so she stands this way to keep herself from going. And she's done this so much that she's sort of changed the joint structure of her knee. So we'll see, again, the posturing, gas bloating. Reflux is somewhat common in our kids, and drooling. So if you're seeing drooling sort of past that age of teething, that can be a reliable sign that kids are having some reflux. Undigested food in their stool is a really strong indicator that they don't have enough digestive enzymes. Again, the belly pain, and we'll see that certain food causes behavior changes or physical changes. So sometimes kids will, eat something and their ears immediately or their cheeks immediately get red. Those are pretty common signs. We also see kids who will grind their teeth, again, with the constipation, diarrhea, or both. And sometimes parents will just say, my kid's poop is just weird. I never know what it's going to look like. It's different, day to day. Sometimes it's hard and dry. Sometimes it's wet and runny. Sometimes it's like soft serve ice cream. Sometimes it's this color or that. And so I just summarize that by calling it weird, weird poop. A lot of times kids will, again, withhold their poops, and sometimes they'll smear it too. And those are all behaviors that are difficult, but there's a reason behind it. And we really need to dig in and try to figure out what that is. Sleep challenges. So a lot of times kids are not great sleepers. I know my son was not. Kids will get hyper at bedtime. They'll have trouble falling asleep. Laughing in the middle of the night always makes me think yeast. So if a parent says, they wake up at night and they jabber or laugh or giggle to themselves, I will always check yeast for those kids. Early waking, restlessness. These can be things contributed by oral restrictions like lip or tongue ties, but also can be things like yeast, can also be things like low iron. So for almost every child, I check ferritin, because when their ferritin, the storage form of iron, is too low, it can disrupt sleep. Energy issues. So kids will often have low stamina. They'll want to be carried. They want to ride in a stroller. They'll complain that their legs hurt. They need a long recovery time after doing something physical. So this child is a little guy we brought in for a therapy intensive a couple of years ago. And he's doing feeding therapy right now in this picture with Liz, our occupational therapist. And you can see he's laying down. And so for most meals, he laid down. And what we found out about him is, eating took a lot of concentration, coordination, focus, energy. And to eat effectively or efficiently, he did not have the strength to sit up and do that. He had to lay down. And what we found with him was very significant mitochondrial dysfunction. He could not make energy inside the cell. Oh, so many good questions. I'll get to them in just a minute. All right. Now, next steps. So I've kind of painted a picture for you here of here's what chemistry is like. Here's what it can look like when chemistry goes wrong. So if you're concerned about your child, we have lots of ways to help here. I do several different nutrition testings. We have different options depending on, what your child presents as and what they can tolerate in terms of specimen. So what blood, urine, stool, etc. We also have a lot of options for testing intestinal health as well. So we can look for things like a bacterial overgrowth. We can look for yeast overgrowth, malabsorption, etc. What makes us different, though, is that we are masters at analyzing the results, and we offer a comprehensive care plan based on those results. So it's not like I'm asking you to spend, $300 on a test, and then I just hand you the results and say, have a nice life. That happened to me with my son, and so we don't do that here. I only order tests that I think are pertinent because I understand we all have limited resources, right? Resources might be time, might be emotional bandwidth, might be money. And so I'm very cognizant about only ordering the things that I think are necessary. I know how to analyze these things. And so I will share with you, okay, here are the findings. Here's what it means, line by line. And then, again, offer a comprehensive plan based on that. All right, so let's jump into these questions. There are a lot of them. So Brittany asks, I just had my 3-year-old allergy tested for foods inhalants over the summer, all negative for celiac, had lots of labs done that are normal. Okay, so right there, if you needed help and thought we were a good match, I would want to see those and look at them from a functional lens, because it's easy to look at the reference ranges on labs and say, oh, it's normal, when it might be borderline. And so we might be able to read a little bit more into that. Very picky eater, doesn't sleep well, started on a multivitamin. She does have bumpy skin, upset. Yeah. Any idea what's going wrong? Extremely tired. Yeah. So the fits are exhausting. Yeah, for sure. So I would look at a couple of things. We do what we call a neurodevelopmental exam here, where we look at the trajectory of brain development. So we look at things like their audio visual system. We look at, can they track their eyes appropriately? Do they have retained primitive reflexes? That's a part of the picture. And we pair that with nutrition testing. The test that I really like to do is urine. So it's super easy. I would probably piggyback some labs, some blood work on there as well, just to cover all the bases of the things that we've talked about. Pediatrician refuses a viral panel. Oh, Lord, it is not rare for kids to have nutrient deficiencies. I have, file after file, thousands of patients here who we do nutrition panels with, and it's rare to see one that's normal. So there we go. She's also had a sleep study, snores a lot, but the sleep study was fine. I would also with her have an oral motor assessment done as well. Check her for oral restrictions, because, it's part of the picture. And I think it's important for us to rule out. Very constipated. Yeah. Very short hair. Yeah. Oh, you do have an appointment with me in April. Happy day. Oh, I can't wait. Good. Yeah. It's going to be interesting for you and for me to kind of see what we end up uncovering about her. Okay. Marianne. Hi, Marianne. My granddaughter is anemic, very constipated. Don't give her iron because it makes it worse. MU's bowel clinic with little success. Also, which B vitamin does the body? It's actually. Oh, I'm having a blonde moment about absorbing iron. We'll talk about that the next time you're here. Suggestions. Gosh, let's visit Marianne and see if we can't brainstorm about. I would have expected her constipation to be better at this point. So yeah, let's definitely talk about that. I'll make some time. I'll have Brittany get with you, and maybe the next time you're here for an ion cleanse, I will block out that amount of time and we'll chat about that. Okay. Any other questions that I can answer for you before I let you go? I hope you found it helpful. Okay, good. I'm just looking, make sure there are no other questions. Okay, good. Good. All right. So if you have other questions, if you'd like to make an appointment, we have quite a big staff here now. So this photo, of course, is me. And then we have Dr. Kayla Nieper. She's an associate chiropractor. The next one next to her is Dr. Strong, our pediatrician. And then we also have Dr. Maddie Lehman, also a chiropractor as well. And so we have as well a physical therapist, an occupational therapist, and a lactation consultant on staff. So this is our contact information, our address, the office phone number, our website as well. So any questions that you have, my email is drsonia@covenantwellness.net. I'm happy to answer. I get literally hundreds of emails every week, so I do my best to get back to you as soon as I possibly can. All right. Good. I'm excited to meet with you. We're all exhausted. Brittany, I can only imagine. I remember when my son was struggling. Also, constipation, alternated with diarrhea, the skin stuff, never slept, only ate 3 things. Like, you really think this is my life now? Like, how am I going to survive this? So I totally get you. And I'm excited to meet you and your kiddo as well. So, all right, guys. So, next month in April, should be the first Friday in April, I am doing another webinar. My blonde moments are really frequent this morning because I can't remember the topic or the date. But anyway, you'll get emails about the next webinar. So you always have access to the replay if you've registered, so you can watch it as many times as you want or share it with people. So again, thanks for attending. It was a nice crowded house today. I hope everybody has a great weekend. And again, if you have any questions at all, just feel free to call the office or shoot me an email. All right, we'll talk to you soon. You guys have a great day.